Hi there, welcome to Dr. Nora's clinic. Today I'll be talking you through everything you need to know about type 2 diabetes, from what it is, who is affected, what the symptoms are, and how best to manage it. First up, let's talk about stats. With this form of diabetes accounting for 85 to 90% of all types of diabetes, and approximately today in Australia 1.4 million Australians being diagnosed with type 2 diabetes, is it time that you knew about this growing epidemic of the 21st century? So what is type 2 diabetes? Well, to explain that, let's take a step back and look at sugar. Normally, when you have sugar in your diet, your body produces a chemical called insulin, which helps to convert sugar into energy. Now, the more sugar you have in your diet, the more energy is produced for you to utilize, and if you don't use that energy, it gets stored as fat. Now, where type 2 diabetes comes into play is if you continually have a high amount of sugar in your diet, then your body will have to produce more and more insulin to keep up, which will clearly have a negative impact on your pancreas. And what's worse is your body may start to develop resistance to insulin as time goes on, so that when insulin carries sugar to your muscles and liver for energy, your liver and muscles will say stop, sending your pancreas into overdrive to produce even more insulin until it eventually wears out. But why is this important? Well, if you're not able to convert the sugar into energy, then the sugar will simply pass through your body and you won't have any energy, leading to you, of course, feeling tired, sleepy, and more severely leading to organ damage. Although type 2 diabetes commonly affects those aged over 45, we're actually seeing it increasingly now more in young adults and children. There are, however, some risk factors that you should be aware of. First up, being overweight. This is particularly important if you have a lot of belly fat. As a woman, if you have a waistline of over 88 centimetres, you are 3 times more likely to be developing diabetes in future. And as a man, if your waistline is over 102 centimetres, you're at a 5 times greater risk. Studies have suggested that this is because the fat cells release chemicals inside your body which can make you more resistant to insulin. Secondly, research has also shown that having a high blood pressure can lead to type 2 diabetes. But also importantly, having high blood pressure can also lead to kidney problems and vision loss, so it's important to make sure that your blood pressure is within a target range. We also know that certain ethnic groups are at a higher risk of developing type 2 diabetes, such as those from an Indian subcontinent and Aboriginal and Torres Strait Islanders. We also know that type 2 diabetes can run in families, so if you do have a family member who is affected, you're at a slightly increased risk. So it's really important to have a regular checkup. But will I have any symptoms? Well, diabetes can be silent to start with. However, some people do develop symptoms, and these can include passing urine more frequently. Now, an average person will pass urine about 4 to 7 times in 24 hours, but diabetics can go more frequently because the sugar is simply passing through the body, which can make you feel really thirsty and tired as well, and having little energy. Diabetics may also suffer from skin problems such as recurrent skin infections, including boils. They may also suffer from blurred vision, and this is because the sugar that's passing through the body will cause damage to those small vessels, including those behind the eyes. Did you know that diabetes is the leading cause of reversible blindness in Australia? That's a shocking figure, so it's really important that if you do have any of these symptoms, you seek medical advice and so you can get a checkup and a blood test. But Dr. Nora, how is type 2 diabetes managed? Well, there are a few ways to manage type 2 diabetes, and this will depend on your sugar levels and the symptoms, and you'll best be directed by your doctor or diabetes educator. Broadly speaking, type 2 diabetics will be encouraged to carry a healthy, active lifestyle. This will include regular physical activity and ensuring that you eat a healthy and balanced diet. And in a number of patients, this may be enough to manage their type 2 diabetes. However, in some patients who aren't able to maintain their sugar levels may need to take medication, and this can take a tablet form. Your doctor will ask you to measure your blood sugar levels on a regular basis so that they can change your medicines according to what your sugar levels are doing. In other patients who aren't able to maintain their blood sugar levels with optimal tablet medications will be offered insulin injections. It's important to note that whilst you may be on medication for type 2 diabetes, these do not substitute having a healthy and active lifestyle. When you're diagnosed with type 2 diabetes, your doctor or diabetes educator may want you to check your blood sugar levels at home. This is especially important when you first started a medication to check that you're on the right dosage. But how do we do that? Well, let's take a closer look on how to check your blood sugar levels at home. Okay, so now that you've got the numbers, what do they actually mean? Well, for patients who have type 2 diabetes, your diabetes educator or your doctor will tell you your target range. Roughly speaking, the target for type 2 diabetes is 6 to 8 millimoles per litre before starting a meal and 6 to 10 millimoles per litre 2 hours after starting a meal. If you are getting readings outside of this, please do speak to your diabetes educator or your doctor for further advice. But why is it important to keep my sugar levels within the target range? Well, this is really important because this helps to reduce any long-term complications that can occur with diabetes. For example, did you know that diabetics are at a 4 times greater risk of developing heart attacks and strokes? They're also at an increased risk of developing further organ damage, such as kidney failure, needing dialysis later on in life, and also vision problems such as blindness. It is imperative that you keep your sugar levels well within target range, and to keep track of this, your doctor will do a blood test every 3 to 6 months called your HbA1c, which has a look back of the last 3 months of your sugar levels. This will then help your doctor to decide whether you're on the correct medication and whether it needs to go up or down in dosage. As part of your diabetes care, you'll also be offered an annual eye check, which has a look at the back of the eyes, and this looks out for any small vessel damage behind the eye to prevent anything like blindness later on in the future. So it is really important that if you are diagnosed with type 2 diabetes, you maintain a healthy, active, balanced diet, keep up your physical activity, but also take your medication as prescribed. It's also really important to keep your blood pressure within control and make sure that you keep an eye on your blood sugar levels at home. By doing this, it will help you to live a healthy and happy life and reduce your risk of complications from type 2 diabetes. I hope you've enjoyed this video, and if you do have any questions, please don't hesitate to drop me a comment in the comment section below. And be sure to hit that subscribe button for the next episode of this Diabetes Awareness Special. But for now, take care and stay healthy.